Dr. Wadid Cruzado has served as president of Montana State University since 2010. Born in Puerto Rico, Cruzado was a Spanish language and literature professor and was also interim president of New Mexico State University from 2008 to 2009. In 2012, she was appointed by President Barack Obama to the Board for International Food and Agricultural Development, and she's garnered numerous awards for her work in education. Dr. Cruzado, welcome, and thanks for joining us on the Big Sky Virtual Town Hall.
Thank you so much, Joe, for the invitation. A pleasure to be here with all of you.
With approximately upwards of 16,000 students, MSU is about 6 times the entire population of Big Sky, Montana, where we are. You're essentially heading up the equivalent of a town. Brandon touched on this with Commissioner Christian, but I'm curious about your perspective. What were some of those biggest challenges you faced this summer as you and your team prepared to reopen the university?
No, thank you so much. Well, first of all, I need to say, yeah, we have a good-sized university. We're very proud of it. We're also very proud that as the land-grant university, we also have one extension office in each county of the state of Montana. So in that sense, we can truly say that the entire state is our campus, right? And with that sense of profound pride, we also have all the concerns associated with it. Because in a way, we have been monitoring the situation primarily from Bozeman, but not only from Bozeman. We have 7 agricultural centers throughout the state. Again, we have 56 county offices. We have 3 affiliated campuses, and then we have our students, faculty, and staff in Bozeman. I think not too different from what Nettie and the commissioner were saying. First of all, during the summertime, the biggest challenge is the uncertainty, right? Trying to forecast the future, working on 3 different scenarios, not knowing which one is going to develop, right? When do we start classes? Today would have been the first day of classes in a normal calendar. Pretty soon we determined that perhaps what we needed to do was to avoid a similar situation as in the spring, where we dodged the bullet of bringing students back from the spring break, for example. Well, we wanted to do the same thing by just reconsidering the Thanksgiving break. And in that sense, what we agreed was, let's start earlier so that we can provide the same quality of education, but then finish before Thanksgiving. And then when students are done with finals in the fall, then they can go home and they don't need to come back until January. But now it's easy for me to tell you that in a minute, right? The number of data, of analysis, of surveys, of consultation with faculty, with staff, with accreditation bodies was absolutely monumental. And a big shout out to incredible people that we have at Montana State University, because they work very hard this summer. And I will finish with this, Joe. Today we just published the numbers of summer enrollment. And I'm very proud of the fact that we had the highest FTE enrollment in 20 years. So we had more students taking more classes during the summertime because maybe they were bored back at home, but they decided to do something very productive, which is to accelerate their curriculum and their time to graduation.
And those were up about 12%, is that right?
12%. Good job, Joe. Yes.
Well, thanks for that. You did talk about starting classes August 17th, 2 weeks early, ending the semester 2 weeks early, on November 25th. Just briefly, if you could talk about some of the other precautionary measures the school has taken this semester.
Well, again, pretty much what the commissioner explained.
Mhm, mhm.
We took every classroom and we reduced the seating capacity to 30%. So that means that there were a number of classrooms that, due to its size, we were not able to use.
Sure.
So we needed to move. We're teaching classes now in ballrooms. We're teaching classes in theaters. We're making very judicious use of every space so that students feel safe. We went ahead and we strengthened our requirements for face masks. So we moved from first strongly recommended wearing masks to now requiring masks anytime that we are indoors. And a couple of weeks ago, when students were back, I invited them, let's step it up. Let's wear that mask anytime that we are in campus. And it's very rewarding for me as I walk around campus. And I thank students for wearing their mask even if we are outdoors. So it's a matter of being vigilant. It's a matter of also conveying the right message to students. For example, reminding students that the virus doesn't take weekends off. I know that they want to be together at parties or take long road trips, but everything within measure can be accomplished, but not everything will be able to be done as we used to. And,
Sure.
you know, a week ago, on the terms of precautionary measures, I met with all our Greek life groups, all the sororities, all the fraternities, and we had a profound conversation because, quite honestly, it works well, or it works better if they are the leaders of this message, right?
Mm.
If it's not that me pushing down that message to them, but they saying, we're going to wave this flag. This is something that we can get done. So I have been reaching out to student organizations, their leaders, our very own student body government, and they are the ones driving this message home. They
Sure.
want to stay in campus. That's one thing that all of them have in common. We're so happy to see them back. They are elated to be back on campus, and that's what we all want to have.
Absolutely. Yeah, you basically did answer my next question, but contact tracing across the country has identified student parties and get-togethers as sources of outbreaks. Commissioner Christian mentioned social separation outside the classroom. I'd just like to dive into this a little more. Where is the line of responsibility drawn between the university and its faculty and staff and the students regarding safety and allowing classes to operate in person this semester?
Yeah, well, I like to believe that it's a shared responsibility, and therefore I have problems when sometimes we start talking about just the students,
Mm.
right? This is human behavior. This is not just young people behavior, and we fail every time that we generalize. There are adults that fail to wear a mask. There are adults that are resistant to these precautionary measures. And by the same token, I have very mature students that one of the good things is that they write to me constantly and they tell me, right? Today at my class, students were not wearing masks, and then we can continue to nudge them. I think that the answer is, what do we want as a society, right? The last few months have been very difficult for all of us. Even if you have been fortunate enough not to get sick, or anyone in your family members or your loved ones have not gotten sick, or a horrible thing happen in your family, we all have a profound sense of mourning, of we have lost our routines, the little satisfactions of life, going out with your family for a Sunday brunch, or going out with your friends to a bar. All that has been severely curtailed. So we have recognized that each of us holds the key to your health, to Clay's Health to people that we don't know. And we now have discovered that in our own very way, we can be agents of transformation. If we all do our part, then we minimize risk. We are able to flatten this curve and keep these numbers down.
Mm-hmm. I'd like to go into that just a little more if I could. So I'm an incoming freshman at Montana State University. I walk in. What does an in-person lecture hall look like this fall? I mean, is it very similar to what it was? Obviously, there's some distancing, and you mentioned masks. But any other specifics that you could kind of give us a picture of what a lecture hall looks like?
Well, Freshman Joe, first of all, the experience started when you arrived in campus. In previous year, we would have moved all 3,500 freshmen in one day. We would have called it moving day, right? This year, it took us an entire week. We moved it from moving day to moving week. And that is because from the get-go, we wanted to send the message that this year is going to be different. We're not going to congregate. We eliminated a number of rituals and traditions. We used to have Catapalooza, which was this thousands of students just signing up for clubs and associations. We moved all that online. So you will find signage. If you are staying with us in one of our residence halls, the first thing, as soon as you walk in, you're going to have a station so that you can sanitize your hands, that we're going to take your temperature right there on the desk, and then you can go forward. You know that you cannot ride in the elevator with one more person. I mean, it's going to be just you. It's just those little things that we hope that we create an awareness and a habit. Then when you go to class, it's the same thing. You will find that each class now has a chart, and there's a map and of how the tables and chairs need to be lined up, and they don't move, right? If it happens that we have left the chairs there, then the chairs are properly identified as to which chair can you sit on. Same thing, we're going to be wearing face masks. Faculty members the first day of classes would have told you, these are some of the things that we expect. And more importantly, and I don't think that we have touched base on that a lot, but we keep repeating, students, if you detect any symptoms, let us know. Mm-hmm. If you have any symptoms, there's help, right? Let's go to the university health partners. Last Thursday, for example, thanks to the commissioner and to the governor, we received some funding from the CARES Act, and we were able to open the symptomatic student center, testing center. So that is exclusively for students, for you, Freshman Joe, so that if you have a headache, if you're running a fever, then you're going to drive or walk to this offsite right by the stadium, right? We're trying to avoid contact as much as possible. And you will be tested for free. And not only that, then you will receive detailed information. We're going to isolate you. You're going to be on quarantine. You just go to your place. We get a pack with your clothes and things, and we will take care of you, right? We will deliver food for you while you wait for your tests. The good thing is that thanks to the testing center that we now have, we're receiving results in 24 hours. Wow. So the quarantine is not extensive. And in all likelihood, good Joe, freshman, you will go back to your residence hall because you received a negative result.
Mm-hmm. How is that going? I read about that you received this money from the CARES Act, and opening this clinic. How is it being received, and how many students are taking advantage?
It's been very well received. So we announced it on Thursday morning. We said that we were going to open it at noontime. And we had about 11 students take advantage of that opportunity. About an equal number on Monday, and then again today. One thing that we have done is that every communication that we send to students, but we also send to faculty, to staff, and we also communicate directly with parents. Same thing, we ask parents to just help us be in a team at this time. Please remind your son or your daughter that there is help available. If they feel that they have some symptoms, please don't hesitate to make use of this. So it's moving apace. The other thing I'm very proud of the students is that they're being very judicious. It's not, they're not using this out of curiosity, but rather, you know, if they have a symptom that they can be confused whether this is an allergy because the season is changing or is something else, they're not taking any chances. They know that they can do that, but they are not using it just for the fun of going and testing.
Thank you for that. Yeah. You know, just about the symptomatic, asymptomatic side of things, you know, CDC recently pivoted its guidelines. And MSU is not offering surveillance or asymptomatic testing. Is that because of these adjusted CDC guidelines, or are there other reasons?
Well, there are two things about that. MSU is offering surveillance for the state. So a few weeks ago, if you remember, Governor Bullock reached out to us to see if we could help processing some of the surveillance testing for the state.
Sure.
And that is another thing that this virus has taught us, is how to be nimble and how to just, we have always been hardworking people, but now we do it very, very fast as well. So we are doing that thing, surveillance for the state. We are in the process right now in conversation still with the system, and that is still a possibility that we are contemplating with this task force that the commissioner put together. So it's not that it's surveillance, it's not done now because we didn't do it at the start of the semester. There are several methodologies that are available. You know, wastewater testing is one of them. And but we're still in that process of finding what is the right decision for each of our campuses before moving forward.
Got it. Now, thank you for that clarification. You know, lastly, Dr. Cruzado, okay, you know, it's spring 2021, fall 2021. In your estimation, what does the future look like, and where do we go from here?
Well, this situation has shown us again how much we appreciate each other, how important higher education is for Montanans, and what a very important role we have to play in society. We always take special pride on the fact that we say that every day we do three things with excellence. We educate with excellence, we do research with excellence, and we do outreach with excellence. And during this crisis, I can tell you, we have been blasting off from every cylinder. We have been, our researchers have been there on the front line, lending us their expertise. Our county people, again, through Extension and others, they have been out there disseminating accurate scientific information for our communities. And our faculty members have found new and innovative ways to teach our students. So what's in the future? It's just that recognition that higher education is the answer and the solution that we need. One last thing that I will say, kudos to the younger generation that's coming up. Right now, applications and interest in medical fields, in nursing, in healthcare professions is off the charts high. So while there might be some of these incredible challenges in the future, we know that universities have the answer for those challenges, and we are in a very good path. It's a great place to be.
Oh, that's fantastic. President Juarez Cruzado, thank you so much for your help. Brandon, any follow-ups or audience questions that you have?
Yeah, thanks, Joe. And thank you, President Cruzado, for your insight. I do have one audience question from Cheryl. You just mentioned the research that MSU is doing. She would like to know if you could talk a bit more about MSU's participation in vaccine trials and virus research.
Well, we have a number of faculty members who are very involved in many of these initiatives since day one. We have a great microbiology program. We have, goodness, for decades, we have an emerging diseases group. So they have been on the lookout for a pandemic. So while some of us were surprised back in January about this virus coming to our coast, they all knew right before us that this was just a matter of time. We have a faculty member, for example, Blake Wittenheft, who has been very involved in wastewater testing. And he was one of the first ones who were able to tell us in Gallatin County when a surge was coming. So it's almost like being right there at the forefront. Michelle Flanagan and others have been working hand in hand with Bozeman Health Hospital. So they are part of their team who's working on the vaccine, working on prevention, working on some medications. So that's the one of the most important things. We are about to announce that this last year, research expenditures experienced another spurt of growth at Montana State University. So while it's true that these are challenges, how rewarding it is that we are surrounded by incredible professionals, researchers of a high caliber that could be in any extraordinary university or hospital in the world, but they are right here in Montana.
Yeah, definitely. Well, thank you again, Dr. Cruzado, and I wish you luck with the remainder of the semester.
Thank you so much. Thanks for the invitation.